My name is Dr. Jodi Frey. I'm a professor at the University of Maryland School of Social Work and the faculty executive director of the Behavioral Health and Wellbeing, or BeWell Lab. So I'm often asked by employers, what questions should we be asking to really understand our employees' well-being? First, it's so important to talk to your employees. And when I say talk to employees, not just talk, but listen and be prepared to respond. I think it's critical that employers provide safe and anonymous options for employees to provide their feedback about how they're doing and what they think their employer could be doing differently or more of in order to be responsive and supportive to changing needs. I also think it's really important that employers need to not only ask, what are our programs or maybe our vendors doing for our employees, but they also need to take a look in the mirror and think about what are they doing as leaders to cultivate a culture of caring or to actively endorse and encourage employees to utilize the programs in which they're offering throughout the workplace. Are employees actually supported to use these programs that are designed to help us balance the sometimes competing needs of work and life? Or are, as employers, providing lip service and even worse, maybe setting up barriers to help seeking and having the consequences for using the services? So listening, responding, and opening up the doors widely to services are very important. I also get asked about what kind of tools are effective to support employees in terms of their mental health and well-being. And the answer is not simple. There isn't one policy, program, or training that's going to solve all of the problems and concerns that we have about employee mental health. Although I am often asked, what is that magic recipe ingredient? Mental health is complex and it's dynamic. It's really important as employers that we think about comprehensive programming that is supported to be meaningful and effective through our policies, and also designed not to just help resolve mental health problems, but to help employees thrive. So one of the things that I'm really encouraging employers to think about these days is to move upstream and to think about having programs that are responsive and high quality, but also thinking about what is the role of leadership to cultivate a changing culture, to provide active and ongoing communication that works to reduce fear and stigma, to help employees really use the services that we are providing. And also to think about our midstream approaches to mental health and well-being, training, universal screening, and the importance of developing roles like peer support or ambassadors that can help suggest and help navigate employees in need to those resources that we're trying to promote. So all three levels, upstream, midstream, and the downstream, where we think about our crisis response and our counseling, they're all equally important as tools, and not one will work without the other to promote mental health, well-being, and to encourage overall resilience that will be evidenced in workplace outcomes.